Welcome to our show, Hair Transplant Step by Step FUE, episode number 6. In this episode, we are talking about counting the number of grafts. Now, whenever you go for any hair transplant consultation or you talk with any doctor about that, the whole conversation is in terms of number of grafts required. These are number of grafts we'll be extracting, these are number of grafts we'll be implanting, based on which this will be the time required for your surgery, this will be the final outcome of your surgery, this will be the density that we'll be able to achieve, these are the areas that we'll be covering, these are the areas that will not be covering. So in all these questions, the main center point is the number of grafts. Now, how one can decide that what number of grafts were extracted, implanted, or how the doctors or the surgeons or assistants, they count the number of grafts. Now, for a patient, it is very difficult to know that what number of grafts were performed in that particular case, extraction and implantation. More or less, you have to trust on the person with whom you are undergoing your hair transplant surgery. So the idea is you have to find a proper person with whom you are satisfied with all your questions and all, and then you can simply go ahead with that. But there is a way in which we count the grafts when we are extracting them. Now, there are different methods. One is automatic counter, which are sometimes attached with the machines. So every time you are using the machine, the counter counts how many times, how many attempts were made to extract the grafts. Automatic counters are the one which patients can see while the surgery is going on. So they can see that, okay, 100 grafts are done, 200 grafts are done, 2000 grafts are done. They're visible in the digital display. But the catch here is the automatic counters, they count the number of attempts the extraction was done. Now, every attempt need not necessarily mean a graft extracted. So there are few attempts which are blank, which didn't have any graft extracted out of it. There are few attempts which left with transected graft or partial transactions or not so good quality graft which are not taken into account. So the actual number of grafts that we have in our hand are less than what are visible on the automatic display screen of the machine. So that is one place where patients can get misguided that, okay, 2000 grafts were performed in my case, but actually the number of grafts extracted were probably around 1000 or 1500. There is a manual method too for counting the numbers. While extracting, we go on counting how many numbers are taken out, 1, 2, 3, like that. We segregate into bundles for ease of counting so that we know precisely that how many we have, and then while implanting, we start using those segregated bundles. With the manual counting, if patient wants to know that how many were done, probably his or her relative can counter check that. It's easy. It's not that difficult because the way it is segregated, anybody can do it. But as I said, the best way out is trust the person. Do all your research before that, but then more or less you just have to go ahead with it. There are other things which are important in counting the grafts. Some graft has single hair inside it, some has 2 hair inside it, some has 3. Now, when we talk about graft, most of the times this means 1, 2 and 3, total 3 grafts. Sometimes at few places they consider this as 1. This 2 haired graft is divided into 2 single hair graft and 3 is again dissected into 3 single haired graft, which gives you 1 plus 2 plus 3 is equal to 6 graft. Now there is a little technical difference here. Every time the attempt to extract was performed, you take out 1 graft each. So there were 3 attempts performed and you got 3 grafts. But then out of these 3 grafts, if you dissect them and then you make 6, these are the 6 hair present inside these 3 grafts. But they are not necessarily 3 grafts. They are not 6 grafts, they are 3 grafts only. So that is why when you are talking in terms of number of grafts, one needs to clarify, are we talking in terms of graft or are we talking in terms of hairs? Because number of hair are always more than the number of grafts. So say for example you are going for a 3000 graft session. On an average, a 3000 graft session has some of single hair, sum of double hair and sum of triple hair. So the total number of hair in that 3000 graft session may turn out to be somewhere around 6000 to 7000. But the doctor talked to you about 3000. Rest all parameters were fixed based on 3000, not 6 or 7000, because these are the number of hair, not the number of grafts. While at some places they discuss in terms of number of hair itself. So the same 3000 graft session at one place may become 6 or 7000 graft session at the other place. But the difference is these are the number of grafts 1, 2 and 3, while these are the number of hair, multiple inside them. So this is one thing which one needs to be careful when they are deciding and designing the hair transplant session. With number of grafts, just make sure that you select the proper center and the proper doctor performing your surgery, so that you are double sure that what you had planned for in the consultation room, the same thing is executed in the operative room. So that's why there are no loopholes or mismanagement everywhere. Anyways, we try to take care of this question as much as we could, but if you have any other queries related to this, feel free to ask us, email us or contact us on phone call. Thank you. See you in next episode.